Nothing hurts an adult, nothing hurts a parent more than to hear our child has been diagnosed with cancer. Nothing hurts a parent, nothing hurts an adult more than hearing what's that diagnosis and what is I feel this. I really do feel this because more and more children are showing with cancer. What is happening at our hospital, you ask? And so we get some insight on what's happening at our hospital now as we're joined by Dr. Chantelle Browne-Farmer, who is consultant pediatrician and a hematologist-oncologist at the QEH. And she's doing phenomenal work there, her team. And we meet this morning a survivor of acute lymphoblastic leukemia herself in Shellana David. Both of you, good morning.
Good morning.
Hi,
What's going on in cancer treatment in Barbados, Dr. Farmer-Brown?
Well, thank you for having us, Pearson. It is Child Month, and commonly in Child Month, we discuss matters related to children. Child health is one of those areas, and specifically pediatric cancer. It's an area that tends not to be discussed much at all. Many persons, I think, still believe that children cannot get cancer and until maybe a diagnosis comes close to home. And so it's really to make people aware that children do get cancer, but pediatric cancer is actually more receptive to treatment than adult cancer.
Really? Why?
And so generally the outcomes are better.
Why is it more receptive?
So it has a lot to do with the nature of the disease. Adult cancers tend to be caused by environmental exposures and poor health habits over time, whereas pediatric cancers tend to be a lot more random events and maybe even sometimes there is an underlying genetic basis, which over time we have had lots of advances in the therapies that we're able to offer to deal with that. And children in general are just far more resilient in terms of being able to train their cells, if you will, to be able to behave a little bit better.
And as with regular people, there are different forms of cancer. Generally, is there a trend that you're noticing of cancer in pediatric cancer in Barbados?
Well, in general, pediatric cancer is rare. And it is the same here in Barbados. So we see about 10 cases of new diagnoses of cancer every year here in Barbados. Globally, the most common form of pediatric cancer is acute leukemia. And with acute leukemia, the most common type of leukemia is acute lymphoblastic leukemia. And that form of leukemia actually responds very well to therapy. That is the state internationally, and it is also the state here. So we have quite a bit of success. Other cancers include things like brain tumors. We see solid organ tumors like liver and kidney as well, mostly in smaller children. We can also see bone tumors sometimes in older children, and we also see a lot of lymphomas. Those span over a wide range from small all the way up to children like Shellana's age 18. And a lot of our lymphomas also do quite well. Hodgkin's lymphoma, for example, is a good actor, if you will. We have high rates of survival as it relates to that.
And then we scratch our heads as to treatment options. Let's start from the hospital's perspective, the QEH's hospital perspective, as to what treatment options are available so that you comfort us in knowing that we can be treated here, our little ones.
Yeah, so we have been fortunate in Barbados to have access to pediatric oncology specialists for about 30 years here on the island. So there's always been at least one. Right now there are two. And that may not necessarily be the case for other islands within the region, but it has definitely been the case for us. So we have had pediatric oncology specialist-led care for several decades, which has allowed us to keep pace with several of the advances in oncology treatments and make sure that we can deliver them here on the island. And then in 2013, we would have had a collaboration with the Hospital for Sick Children and 5 other Caribbean islands, including Jamaica, Trinidad, Bahamas, St. Lucia, and St. Vincent, with the Hospital for Sick Children, as I mentioned, to essentially enhance further our capacity to be able to care for patients with pediatric cancer here in Barbados.
What does that collaboration bring?
Yeah, so what that has done over the years is allow us access to be able to train our physicians. So we have more than doubled the number of regional pediatric oncologists through that collaboration. We have also trained a cadre of pediatric oncology nurses scattered throughout the region. And so we have some of those nurses here in Barbados who obviously form a core part of our team in terms of administering therapy to children. We have immediate access to advanced laboratory diagnostics for definitive diagnosis of cancer, including markers that may help us to target therapy as well. And then we have access to a community of physicians, both regionally and internationally, where we can have case conferences on difficult cases, review radiology images for patients, and this is something that exists in other institutions where cancer is managed. You have the ability to have a group discussion, and so we have that ability as well. A big group, everybody is sharing ideas about the particular case or cancer that we're looking at and coming up with a well-tuned plan for treatment of cancer.
We're looking into the Queen Elizabeth Hospital as it relates to pediatric cancer and the options available here on island and the skills that are available already here on island to help with treatment thereof. And so Shellana David, who's 18 years old, has been diagnosed with acute lymphoblastic leukemia, and she's surviving this through her collaboration, her treatment here. Shellana, good morning to you.
Good morning.
18 years old.
Yes.
How long have you been living with this cancer now?
Well, I was actually diagnosed twice. I was diagnosed from the age I was 6. I was declared cancer-free at 10. And then when I started going through puberty around 12 years old, I battled it again and I became cancer-free again when I turned 16.
Saying all of that, what goes through you when you begin to mark your life from 6 years old with a diagnosis like that called cancer?
Well, when I was diagnosed first, it came, I guess, in a unusual way. My tummy started to swell. So my mother, being my mother, she took us to our family doctor, and he transferred us to the hospital. We ran some tests, and we discovered that I had cancer. At the time, I wasn't too aware. I was confused. I was very confused at what was going on with my body. Why is this happening? And I started to question a lot. I was very angry when I first got diagnosed. I was very angry. I was very mad. I was mad at myself because I thought I did something to cause it. I was mad at God. I was mad at the whole world. I even refused to talk to my mom for a period of time. And then one day, I just felt this urge to pray because I would have this pastor at my church that would come over. Most days he would pray with us, and most times I would refuse. Then one day I just decided to pray with them and decided that it makes no sense to be angry about it because it's happening whether I like it or not. So I could either go through it with a smile on my face or I could be angry at the world.
Mm-hmm. But it came back.
It came back.
And it came back.
The second time, it definitely hit me harder because I was finally getting used to being normal. I was running again. I was getting used to my hair growing back. The second time, it definitely hit me harder because I understood now what I was going through. And I cried. I cried a lot because I was in my head and I was mad at God again because I was wondering why this is happening to me, I started questioning God a lot. I started questioning everything again. And I remembered what I told myself the first time, that I could either be angry or I could be joyful.
And that's what you chose instead to do.
Yes.
And how are you now?
I'm good. I'm in remission right now. It feels good. I'm actually training to be a nurse right now in the pediatric section. So
Wow.
I'm doing the nursing assistant course right now. Today, I actually have my math exam to do general nursing.
Given your drive, I know you'll do very, very well. But in terms, doctor, of treatment of her, Shellana, because 6 years old, first of all, and then later on it repeated itself, what treatment options are available here in Barbados?
So Shellana had, as I mentioned, the most common type of pediatric leukemia, which is acute lymphoblastic leukemia, and then there are two different subtypes of that. Here in Barbados, we have been treating children with acute lymphoblastic leukemia for many years, as I mentioned. But most recently, through the SickKids Caribbean initiative, we have forged bonds with other international organizations. So the American Society of Hematology has a consortium that we are a part of called the Children's International Consortium for Acute Leukemia. And within that consortium, we have developed a standard of care protocol that is at international standards and levels in terms of the types of medications and so on used to treat lymphoblastic leukemia in current day. That protocol has been with us for about 7 years, and so all of the children who present to us now with acute lymphoblastic leukemia are on that protocol. If we look at the outcomes for those children, if we look from January 2020 all the way up to date, there have been about 16 children that we have diagnosed with acute lymphoblastic leukemia over that time, and over 85% of those children are in remission. Many of them are actually fully completed treatment, and a few of them are still in treatment but in various stages of completion and doing well. So our outcomes there are definitely good and demonstrate that there are options for care for that type of cancer and for many other types of cancer right here at home in Barbados. You were mentioning, Pearson, that it's devastating to receive a diagnosis of cancer for your child. And I think it would be quite difficult to have to, while dealing with that degree of devastation, kind of, be scrambling and looking around for, where do I go now to get treatment? Therefore, I think, we kind of take that part of it completely away, because treatment is definitely available here. It is free of cost. Everybody knows once you're a Barbadian, you access free health care through the public system. And our relationships have allowed us access even to donations of medications to boost what we already get from the government to manage children with cancer. And then further to that, as I mentioned, there are islands within the region who do not have direct access to a pediatric oncologist, and they reach out to us all the time to refer their children and have us accept them for care. Of course, they would have to pay a contribution towards that care, but it is at a tiny fraction of what it would cost if you had to seek that care in other markets like the US and the UK. And treatment of something, for example, like acute lymphoblastic leukemia is a long time. It is at minimum 2 years. And trying to support that high level of intensive treatment for 2 years in a whole other country away from family would be very difficult. And so I think it's very advantageous that we can do it right here on the island. And that's what the SickKids Caribbean initiative has ensured that we are able to do.
This is so wonderful to know that our world-class Queen Elizabeth Hospital provides the services, they have the skill sets, they have the support to manage the process when your child is diagnosed with cancer. With that diagnosis, I know it comes with a lot of emotions, but it comes with a lot of desire for practicality as well. And that practicality already exists at our Queen Elizabeth Hospital, and they've been practicing what they do now for quite a number of years as well. I hope we've been able to calm your fears, calm your hearts, calm your mind for just a moment, knowing that the services are available on island. And for those of you watching from the region as well, if you don't have those services in your area, the Queen Elizabeth Hospital in Barbados is able to provide you with those required services for treatment of your children who may have been diagnosed with different varieties of cancer indeed. And so to you, Shellana, I'm so excited for your future. Today's exam is going to be a breeze. You will do very, very well. I love the fact that you want to give back in the same area that gave to you.
Yes,
and so you have a wonderful future ahead. Keep walking with your heart to lead the way, and you will do well.
Yes.
And I'm happy about your remission as well. Long may it be. Thank you so much for joining us today.
Yes, thank
And
you.
Dr. Browne-Farmer, thank you so much for the phenomenal work you and your team are doing at the Queen Elizabeth Hospital on behalf of the people of Barbados, the people of the region, and our little ones who are our future. Thank you so much.
Thank you for having us.
You're very welcome.
Morning, morning, morning. Good morning.